The Treasurer, Jim Chalmers, and the Health Minister, Mark Butler, speaking there. They were outlining the government's response to the recent COVID inquiry. We heard the ministers talking a lot there about the big and costly mistakes that were made as a result of inadequate pandemic planning. Let's bring you more analysis on that now. Joining us live is the health editor at The Australian, Natasha Robinson. Natasha, appreciate your time. Thank you. Part of the government's response we heard about there is this plan to set up a new Centre for Disease Control with $251 million announced to go towards that. Are you confident that that new body will actually go a long way to help us be better prepared for next time?
There's so much to unpack here, Ash. I think it's hugely welcome that we are moving ahead with an independent CDC. That is something that the nation needs. It's something we lacked during the pandemic. We saw, what was coming out of the US equivalent over there in terms of the data that Mark Butler talked about, the importance of that independent data that could be relied upon, that wasn't subject to different measures of, reporting and calculations state by state. So from that point of view, I think it's going to be incredibly important, especially for our preparation as a nation for future pandemics. I think it was disappointing not to hear Mark Butler speak there about preventive health and the very, very important role that, the whole health sector is hoping that the CDC will play in preventive health. That is a pandemic as well, our diabetes epidemic, our rates of, metabolic disease and obesity. So I do hope to hear more about that. But there are, major issues, I think, that we still confront as a nation in facing future pandemics, which are certain to occur. And, probably, the stats on them occurring in, let's say, next 25 years are very high. That is that we are a federation. We have a highly fragmented health system. And I haven't heard yet what the arrangements will be in terms of the legislation that governs the CDC and how much power it will truly have over the states, because at the end of the day, the Commonwealth, while it does have a suite of constitutional heads of power that can swing into effect in something like a pandemic, say in external affairs and quarantine and things like that, it does face that major challenge that the residual power lies in the hands of the states. So if the states want to do their own thing, the states can do their own thing. And that's exactly what we saw in the pandemic, the COVID pandemic that we're examining, and all those criticisms that are coming through now about the inconsistency, the overreach, that lack of trust that is so devastating for our society. That was largely as a result of political decisions. It was largely as a result of, the police being brought in to, round people up if they're sitting having a coffee in the park and not exercising. As Mark Butler said, those things are highly damaging for our society, for our trust in health, and that we're seeing it today. We saw it very quickly start to emerge after the pandemic, where the rates of, in particular, childhood vaccinations just plummeted. And we're seeing conspiracy theories left, right and centre. We're seeing people turn to, unreliable information on the internet, and believe, all manner of things rather than believe what the authorities say. So I think a lot of that came from the overreach, but at the end of the day, do we have a mechanism to ensure a true evidence-based national response next time? I'm not sure that just the actual CDC being in existence will solve some of those problems that boil down to the constitutional, factors that we face in our federation.
Natasha, you mentioned preventative health. That brings me to a story you reported on today showing that people living in disadvantaged postcodes are 3 times more likely to suffer from a heart attack, from cancer or other chronic diseases. The statistics in that report sounded pretty stark.
Yeah, and this is just what I'm talking about in terms of the importance of preventive health. Those preventive health initiatives are not necessarily flowing through to the areas that need the most disadvantaged postcodes. And we've got these inequalities getting wider. So we do have wealthy postcodes, cancer rates dropping in those higher socioeconomic areas, and getting worse in low socioeconomic areas. So we're talking about the outer cities and the rural areas. That's really, really concerning to have that sort of two-speed, society in terms of health outcomes. And it is a very stark demonstration of how our, just those population-based programs to keep people healthy, are just not getting through to the people who need them most. I mean, I think one of the starkest demonstrations of that is in our obesity-hit outer cities. Areas. We have, say, people who want or need to get something like bariatric surgery. Only 5% of that surgery is actually performed in the public health system. That is just, I think, a disgraceful and stark statistic. And sure, surgery is not, the answer to everything, but it's very, very clear that the people who are the sickest are the people who are not getting the best healthcare and the best prevention strategies, delivered to them that they can actually take forward and live a life that's not, to be honest, cut short by chronic disease.
Natasha Robinson, always appreciate you joining us with your analysis on all things health. Thanks so much.
Thanks, Ash.